being available. More than 80% of the 534 deaths so far were people living in long-term care or assisted living centers. One of those facilities has now been cited by the state for its conditions before an outbreak that claimed the lives of at least 47 residents. Kent Erdahl and Brandon Stahl explain the disturbing findings.
On April 14th, 89-year-old Judah Priestler died of COVID-19 inside St. Therese of New Hope with no family by her side.
That's the hardest thing, that you just can't be there with them and hold their hand.
Gabriella Sikic says nearly a month later, her grief is mixed with anger over how her mother's death and dozens more from COVID have been handled. KARE 11 has obtained a newly filed report from the Minnesota Department of Health citing St. Therese for deficient infection control. On April 14th, the same day Judah Priestler died and many other residents battled COVID, state investigators found violations that, quote, had the potential to affect all residents, staff, and visitors residing in the facility. The report cites two issues with staff both failing to doff or remove gowns before leaving the rooms of COVID patients and later improperly disposing of them. In one case, a physical therapy assistant was also not wearing eye protection in the room. In another, a nursing assistant walked into another patient's room before washing his hands and forearms. The report says staff also told investigators they didn't have the proper training to prevent infection from spreading in the home. The nursing home administrator denied that allegation. When KARE 11 asked for comment on the inspection, St. Therese CEO Barb Rode responded, "We have addressed the issue, which was relatively low level, that there was just one in a detailed inspection of a 258-bed skilled nursing home battling an invisible and sometimes fatal virus is a credit to our committed staff, which is working very hard under trying conditions to protect and care for our residents."
Shame on them. 47 residents died in 2 weeks. They did not have the proper controls in place. These are also people I knew when I went to visit her, and they're all gone. I'm sorry.
Though the state is now pledging more outside support for long-term care facilities and mandatory testing through a new battle plan, Gabriella says the damage is done.
It's too late. In these facilities, these residents are so close to one another. It was a petri dish for the COVID. It's just too late.
Kent Erdahl, KARE 11 News.
Well, this is the third time in 4 years that St. Therese has been cited for inadequate infection control.